My name is Michelle Hamilton, and I'm here with my colleague and good friend, Mara Pinot. We are two oncology dietitians here at the UT Southwestern Harold C. Simmons Comprehensive Cancer Center. This video was created to discuss some ways to manage treatment-related symptoms. These shorter videos, like this one here, will cover each individual symptom. For a full overview, please click on the longer video for staying nourished during treatment.
We're now going to discuss constipation. So the big question is, what is constipation? And generally speaking, constipation is characterized by no bowel movements within 3 days. However, constipation can also mean solid stools that are hard to pass or inadequate emptying of the bowels. The best thing you can do is to understand what your normal is and to monitor any changes that you notice. There are a lot of reasons why someone might become constipated, including treatment, medications, changes in activity level, dehydration, lack of fiber intake, and so on. To help become more regular, we recommend setting a bathroom schedule to allow your body to synchronize with your schedule. Additionally, try creating that schedule around your meals. For instance, using the bathroom after eating can be the best time to promote bowel movements because the gut is working the hardest and is activated at this time. You should also increase your hydration, especially if you're increasing your fiber intake. If those tricks do not work, we recommend consuming warm, sugary beverages to increase the activity in your gut. And if possible, try to move more often to increase gut activity. So I will briefly discuss fiber. Fiber is a part of a food that helps things move through your GI system a little bit faster. So if you are dealing with constipation, fiber can kind of help clean you out a little faster than if you weren't consuming fiber. The big caveat here is that we need you to increase your fluid intake while you're increasing your fiber intake to really help the digestion and to reduce any kind of stomach upset. If you're looking at a food label, make sure that the food has 3 grams of fiber or more per serving, or that you're choosing foods that are more plant-based, like fruits, vegetables, whole grains, beans, and so on. Here are 2 recipes that you can try to increase the fiber in your diet. So feel free to be creative and create your own high fiber recipes. This recipe on the left is for fruit and bran, and you can put it on a piece of toast in the morning to kind of get things going. Or power pudding on the right is a good one to consume throughout the day or even in the morning again to get your body to get your bowel movements moving. Here are some complementary therapies, stomach massages. Have your friend or family give you a little bit of a massage, try to get some things working there. Yoga and stretching can be very beneficial as well. And then the way you sit on the toilets is can be very conducive to producing a bowel movement or can not be so. So make sure that you try some of these little tips and tricks as well as you're trying to figure out what works for you. So the other type of constipation is called opioid-induced constipation. And so there's a couple of recommendations that are specified towards this type of constipation. And those recommendations are really just to provide adequate fluid intake, exercise or movement, whatever you're able to do, and a regular balanced meal pattern. Now, it's not necessarily recommended to increase fiber in general with opioid-induced constipation because it's the medication that's causing the slowing of the bowel movements through your system. However, soluble fiber is okay. We really, really want to reduce the insoluble fiber, and that's what is shown on the right, the difference between soluble and insoluble. However, in general, we don't necessarily recommend an increase in fiber. So here are some examples of laxatives and stool softeners that you may be prescribed or use if you have opioid-induced constipation or just constipation in general. These will be recommended or may be recommended by your medical team. So definitely reach out to them for specific recommendations. But here are some information on how they work and what they're called. Again, we do not want you to take any kind of fiber medication or supplement or anything like that because of the opioid-induced constipation. In addition, there are also prescriptions that your medical team can prescribe to you. If the previous slide, those did not work. The big thing here is that reach out to your medical team. If you have any concerns, questions, or if you are dealing with constipation, they are the best contact to help provide you with recommendations based on your individual needs. Here are some additional resources. These are resources that us dietitians use on an almost daily basis. At the bottom is the UT Southwestern Oncology Nutrition website. That's a great one to go to. A lot of information just based on what we provide and recommend within our patient populations. American Cancer Institute for Research is another great one. So reach out to either your dietitians on your team or to these resources for more research-based information. And thank you everyone for listening into this presentation. If you have any questions whatsoever, please reach out to your medical team. And if you don't know your dietitian, they can let you know who that dietitian is. And if you do know your dietitian, please reach out if you have additional questions. Thank you so much and have a great day.
Thank you.